Welcome to The Breakdown with INFB. I'm your host, Heidi Gant. On today's episode, we're diving into some of the challenges Indiana's rural communities face and how we might address those challenges in the future. According to a report from Indiana Rural Health Association, rural counties represent 70% of Indiana's land and 64 of its 92 counties. Yet they account for just 29% of the state's population. These communities often experience lower income levels, limited access to healthcare services, and worse health outcomes compared to their urban counterparts. So to dig deeper into some of these critical issues, we're talking to Dan Hardesty today, who serves as the Senior Director of Government Affairs for the Indiana Rural Health Association. So Dan, welcome to the podcast.
Thank you. Thank you so much for having me. I'm very excited to be here.
Yeah, awesome. Okay, so let's just start out with introduce yourself. What do you do for Indiana Rural Health Association, and how did you get into that work?
Very good. So I like to say I'm the conduit, I'm the connecting piece between our members and elected officials and agencies and external partners like Farm Bureau. I talk with our members to understand what they have going on, and obviously they inform me any topical things that they're dealing with or something that has come up recently that they need elected officials to know about. I also just like to connect them directly with it, because elected officials like to hear directly to business leaders, obviously, in their communities, especially the hospitals and different healthcare organizations. So I serve as that connecting piece for that. And along with that, I do a lot of reading myself to keep myself up to date on what's going on nationally and also in the state of Indiana, and help propose solutions for rural communities and rural providers to make sure healthcare access is available as best as we can, and to keep the rural safety net afloat is really something I think is very topical right now. Gets a lot of attention, and we have a lot of our members who are doing incredible work, and I like to share their stories.
Okay, and we'll probably hopefully get into some of those stories if you don't mind at some point. So high level, we'll dig into some of the specific issues as we go, but what's your initial overall view of how rural healthcare is faring in 2026? Are you optimistic? Or do we have a long way to go? Or how do you think Indiana is doing?
Yeah, I think if you were to ask anybody in the rural health industry right now what everybody's kind of temperature is, it's a very high level of uncertainty. There's a lot of changes coming down the pipeline in terms of Medicaid and some issues regarding reimbursement and other programs such as 340B that leave a lot of our members, specifically our rural hospitals, wondering what's next. We've always had challenges. I would say for a decade or two, everyone has said, we have our challenges, and we can definitely propose different solutions that would make it a little bit easier to provide rural health care, but it's never really been easy. I don't think it'll ever be easy, and I think that's honestly part of the charm. If living in rural communities, I think everybody can understand that, but certainly uncertainty right now. What's next? How are certain things going to play out? We've got a runway of a couple of years. Well, what do we look like in 27, 28, 29 on the state level as well as federally? We're all waiting to see and hoping for certain things to happen, but we don't know yet. So we're trying to prepare as best we can.
So I know a big issue is, I think some people call it brain drain, where if you go to if you're from a rural area, you go to medical school, you get your doctorate, but you don't come back. So I think that's a big issue, is how do we get people to go practice in those rural areas?
Certainly.
So I know there was House Enrolled Act 1358 that requires medical students to complete a rural health rotation to expose them to those communities.
Sure.
Can you talk a little bit about that and what the hope is for that?
Sure. Yeah, of course. 1358 is a bill that we supported moving through the session. It has many pieces in it, one of them being obviously the rural rotation. It is important to expose medical students to what rural health is, because it is in many instances very different than what they're used to, especially if a kid who never grew up in a rural community, maybe never visited rural communities that often. They didn't really understand how really advantageous and how advantageous and attractive rural communities can be. So anything that we can do to expose them to rural communities is obviously going to be a win. With this specific piece of legislation, while students are in medical school, they have to complete at least one rural rotation. That does a lot of things. One, obviously, the student is exposed to the rural community, but also they get to understand what it's like practicing in a rural setting. Obviously, the patients are going to be similar, right? Mm-hmm. Similar issues, similar stories, and things like that. But in its own unique charm in rural communities. Obviously, if you go to a small clinic throughout the state of Indiana, most of the time they're going to have nurses or techs or somebody who's been there for 10, 15, 20 years mm-hmm. who, they've done the check-ins for the babies, and now they're checking in the babies who now have babies, mm-hmm. right? And so that is certainly something that appeals to a lot of people. Mm-hmm. But specifically with this piece, I think that it's a good stepping stone. It's not going to solve the problem. I don't think anybody is saying it will. It will be a good stepping stone, and hopefully we can build upon this to increase right now. And I don't know how familiar you are with how medical training works for doctors, but students get their bachelor's degree, then they go to medical school. We have the largest medical school in the country, NIU School of Medicine, and obviously we have Marian University as well. And both of them are very interested in great partners in rural health, but after medical school, they do residency. So that next step is going to be not only exposing students to rural health and medical school, but also in that residency to mm-hmm. complete their residency. Because if you complete a residency in a rural area, you're much more likely to stay in a rural area and practice there. Mm-hmm. So that's really the next piece. And we've been working with some of our hospitals across the state in implementing new residencies. It takes a long time. But certainly 1358 is exciting, and hopefully we can build on that.
That's good. And I think you kind of mentioned a little bit of this with nurses who are seeing babies, who are having babies. I think maternal care and having a baby in a rural community, I think there are some people who have to drive over an hour just to deliver a baby. Sure. That's scary.
It's terrifying.
Terrifying, especially if you run into some issues. Is there anything that people can do other than moving closer to a hospital or more maternal? What are your thoughts on kind of that maternal care area and where we can go from there?
Yeah, it's a difficult issue. It's not there are no easy solutions. I think if there was one that we would already have done it. Indiana, I believe, leads the country since 2020 in the number of OB units that have closed.
Okay, I was going to ask, how do we fare against other states? Okay, that's great. Not great. Yeah.
And what a lot of people would assume it is, and a lot of it is the rural OB units that are closing. So, but I believe in Johnson County, their hospital, one of their hospitals just closed their OB unit. And
I live in Johnson County.
Okay, yeah, I'm sure that didn't go well.
Yeah,
and they delivered a lot of babies. They
did.
So that
I was born there.
You were.
I was.
That's not easy at all. So it is a very difficult issue, and I think there are a couple innovative things that people are doing. One of them being obviously your EMS needs to be ready if you live in an OB desert.
Right.
They need to be ready to obviously take care of pregnant women and get them to wherever they need to go. And I live in a county that doesn't even have a hospital. So, for us, I have family members who have had OB emergencies in the past, and it's obviously very scary. Mm-hmm. So I like to approach it in a couple of different ways. One is for counties that don't have a hospital, period, the EMS needs to have the resources and the training and the support, obviously, from lawmakers and agencies to have the training that they need to take care of the women whenever, those challenges persist. But once you get out of the counties that don't even have a hospital to counties that have hospitals that don't deliver anymore, those hospitals are going to have to be ready to take care, at least stabilize the woman and the baby and transport them. Because, I have 4 children, and I know a lot of OB providers in this job. And one thing that is consistent is when it goes bad in obstetric care, it goes bad very fast and
Yes.
very, very bad.
Yes.
So it's very specialized, and we want to have excellent care available throughout the state of Indiana, and make sure that wherever you are, if you're pregnant and you're going into labor, that whoever's taking care of you can help you make sure that baby is safe. So I believe that there are solutions out there that we can continue to invest in. Obviously, I've already mentioned training and support for our EMS, and that can go across the board.
And
right?
do we have that? Do we have the right training and support in place for EMS across the board in the state
I think that the availability of the resources is there. The resources are there for them to be able to do the training and to have the different competency credentialing kind of checklist that they need. It's who's going to pay for it.
Yeah.
Because the reimbursement in the EMS arena needs obviously looked at. And it's also difficult in rural areas because the volume of these types of visits are low. So once you have the training, you need to maintain that training over time. So, it's going to take a whole comprehensive solution. There are different organizations throughout the state of Indiana that can provide simulated training where they'll come and they'll train the emergency department, they'll train the ambulance drivers throughout, on a semi-annual basis so that people can keep their skills up to date. But, those are available. It just comes down to funding.
Yeah.
So, yeah.
Well, okay. And so another area of healthcare that I think is very important, especially in the agriculture community, and this is May, so Mental Health Awareness Month.
Yes.
Mental health care.
Sure.
No matter where you are, I think we need some help in that area to get that better built up.
Yes.
But especially in rural areas,
Of course.
I think there's probably data that say that rural communities tend to have probably more isolation, loneliness, which then leads to more mental health issues, suicide rate.
Yeah.
So is there any hope there in kind of building that up in rural areas?
Yeah, there is, especially the more that we get broadband out into rural areas.
Great point.
Yeah.
I didn't even think about that.
The availability through telehealth, specifically in behavioral health, is usually really, really good.
Yeah.
Telehealth is a tool in the provider's toolbox, and it's excellent in connecting people for a couple of different things. You and I, if we have a behavioral health appointment, most of the time we can just hop on our phone or an iPad or something and connect with our therapist and do that there. So as broadband, gets out into the communities and if we're talking specifically about farmers or anybody else and who, spend a lot of time working by themselves, having that the ability to connect is really key. And also it's still important in rural communities. Again, I mentioned I live in a county that doesn't have a hospital, but we have a community mental health center. Sometimes people don't want to be seen going to those places. Right, wrong, or indifferent, that's just the reality.
Right.
So to be able to do it either from home or the car or wherever you are, in your business, in your office, whatever, telehealth can really be impactful in that arena, especially when your local provider is utilizing it. So if you're talking to the therapist you've always talked to, and you can connect to them via telehealth, I think that's certainly one way that we can do it. But really, I think a lot of people need to understand that the resources are getting better for behavioral health. We made a lot of strides there. When you talk to your doctor, you can talk about these things, and obviously it's going to be confidential, and they can help you, connect you with different resources and things like that. So if you are struggling with these things, obviously tell somebody. You're not alone in it. It's obviously an epidemic across the country, and Indiana's not immune from that. So if you need help, it's out there. It may be, obviously we're in a rural community, it may be a little bit more difficult to find it, but it's certainly something that it's getting better. It's not where it needs to be, but it is getting better.
Yeah, I love to hear that. My family personally has been impacted pretty bad by some mental health issues. So I always love to see, some the strides that we're making to get that better.
Yep.
And even in Johnson County, even though we got rid of our obstetrics, we got a behavioral health center. So at least we're at least we're getting better in one area. So okay, let's talk about you deal a lot, obviously, in Indiana Farm Bureau. Policy is a huge part of what we do. Advocating for agriculture in rural communities. So we do a lot at the State House. We do a lot in DC. You all do as well. I know that's part of your role. So the next legislative session is budget session, which is pretty huge for programming having to do with healthcare, I'm assuming.
Yep.
Is there anything, I know that's kind of a ways away now, but is there anything on your list that you really want to see this budget session, or that your members want to see happen?
Yeah, I think something that we've advocated for quite a while, and it was a catch-22 in the last budget session, was an increase in the cigarette tax. We were pretty vocal in that.
Yeah.
Because it shows that it decreases the amount of tobacco use in general, which is good. And so we saw that last budget session, but then we saw the Health First Indiana funding get cut pretty dramatically.
Right.
So something that we've identified pretty early on is another investment, another round of funding in the Health First Indiana program.
And can you talk a little, you can finish your thought, but talk a little bit more about what Health First Indiana is.
Yeah. Health First Indiana was passed under the Governor Holcomb administration, and Governor Braun is supportive of it. It's just the certain budget environment, Health First Indiana wasn't immune to the budget cuts from last budget session. But Health First Indiana really was transformational in how we fund our public health infrastructure in Indiana. It's, as we talk about, I've got connections across the country, and one thing that people across the country have come back to me and said, how did Indiana get this across the finish line?
Okay.
Really, yeah.
So we're doing good in one area. That's good. Yeah.
Yeah. And what Health First Indiana does is it's a huge investment from the state level into local health departments, local county health departments. And what's really good about it is the local health department, the local communities have to buy in. Mm-hmm. And to buy in, they give them the opportunity to select which interventions or programs or resources that they want to have in their community, because local communities know what they need the most. Right. It's not a cookie cutter solution. And what the Indiana Department of Health did in standing up a lot of infrastructure to communicate data to local health departments to say, this is what our data shows your specific county is struggling with or is higher in, or you may want to consider doing X, Y, or Z with the funding. But it was ultimately up to the local health department, and I believe the different county council or commissioners, they had to approve it. And that's what really pushed Health First Indiana across the finish line. Yeah. So it was transformational investment. Instead of doing things that people traditionally think the health department does, which they still do. Your restaurant inspections normally hit the headlines the most. Different testing like lead testing and septic testing and stuff like that. Obviously, the health department continues to do that. But what it did was it allowed them to really invest and bring people in to do education for like diabetes and heart disease and different, like water safety is a huge thing. In my county. Both of our high schools, neither of them have pools. And so, students don't really get that chance to have that water safety kind of embedded in normal curriculum. Just things like that, different opportunities to partner with local health organizations, something that, I live and breathe in the healthcare industry, but before I came to Indiana Rural Health Association, I was at the Lugar Center for Rural Health, which is out of Terre Haute and Union Health, during COVID. And what really opened everybody's eyes during COVID is health departments have a lot of data, but they necessarily don't always have the manpower. Hospitals and health systems have the manpower and the expertise, and during COVID in Indiana, the health departments and the health systems were working together. Yeah. And what Health First Indiana came along and kind of expanded that and continued that. You have the expertise, you have the manpower, let's work together, let's not duplicate anything. Yeah. And so, a lot of health departments were really excited about, because they were moving on to that next partnership phase. Yeah. And that's exciting, right? Yeah. What education, what different programs, what different, workforce exposing kids to different kinds of things in the healthcare industry can we do? So that was exciting. And so looking forward to the next budget session, that's something that is on our list for investment, bringing that funding back up and hopefully The money will be there, and we can, I guess, convince or continue to educate lawmakers that the investment's there. Because I know it can be kind of a controversial thing at the State House, but there are certainly people there in favor of it, and I understand the people who, have questions about it too.
Yeah. Well, and during a budget session, everyone's asking for money. So it's hard to figure out from a legislator perspective how to divvy that up. But, and I know Indiana Farm Bureau and Indiana Rural Health Association and many other organizations, can you talk about some of the coalition building that you all do? I know that sometimes that's how you get big things passed in the legislature, is working together to do that. Is there a key thing? Maybe it's health first. Is there a key thing that you think our organizations can partner up, or you hope to see us partner up on in the coming session?
Yeah, great question. Well, Health First Indiana came about because of that. They held, Governor Holcomb's administration brought together the Public Health Commission, and they studied everything. It was a multi-year process. They had experts from across the state and researchers and health systems and health departments. And so they brought everybody to the table and they studied it, and they came up with this recommendation. And so what I would love to see is the next commission be on EMS.
Yeah.
Because it is a very complicated world. It's one that people are extremely passionate about. It's very difficult. Obviously, being a first responder and or an EMT or something like that, or serving on your local volunteer fire department, I mean, all of those different things play together. And I would love to see everybody kind of coming to the table and coming to a common understanding of what everybody's challenges are, and then figuring out, coming to an agreement on what those solutions should look like. And then ultimately, you would have the ask of whatever that is. Maybe it's different reimbursement, maybe it's funding from somewhere else, maybe it's, who knows what it is. But I think that would definitely be something, and I know Farm Bureau's talked about that a lot, because it's terrifying when you think about it. If you call 911 and no one comes, or it takes 45 minutes for somebody to get there. Yeah. I mean, that's terrifying.
What could happen in 45 minutes?
Yeah, exactly. And that makes it difficult, obviously, to live in a rural community. It makes it difficult to attract people to come to a rural community or stay in a rural community. And so what's exciting about bringing everybody else together is, in rural communities, everybody is used to doing more with less. So, it would be interesting to see like local schools kind of coming in and providing some sort of just basic first aid training to everybody who leaves the school, so that everybody's ready as a stopgap until we can kind of figure these things out.
Yeah, that's a great point. So in kind of wrapping some of this up, obviously a lot of our listeners are farmers or people who work in agriculture or rural communities, who live in these areas, who live in these deserts. Yeah. Is there anything they can do, anything they can get involved in or advocate for that would be helpful over these next few months leading up to legislative session to get some of these things past the finish line?
Yeah. I would say, in the advocacy and lobbying world, it always comes down to relationships, right? And, farmers across the state always have relationships with just about everybody, right? Yeah. So if you're struggling or you need to talk to somebody, obviously go do that on your personal end. But also, if you live in a community or a county that has a hospital, get to know who those people are. Get to know who work in the clinic and ask them what their issues are. Because more often than not, the farmer's going to have a relationship with an elected official, and they can have those conversations there. If you're wondering why ambulance coverage is so, I guess maybe inconsistent in your area, go and talk to somebody and understand why. Don't assume that it's one thing and when really it's another. So always just be talking to people to understand what they have going on, because your voice, you're advocating for your own community, obviously for your business. Being able to do that, I think, is very important to understand the difficulties and troubles in your area. So. And
what we like to say is, we have lobbyists on staff who talk to legislators all the time, but a lot of times they don't want to hear from them.
Exactly
they want to hear from people who vote them into the office.
They want to hear directly from them about what's going on. And a lot of our members are county hospitals, so like they have boards and stuff that the leadership report to, and they approve things. And I'm sure that there are some listeners who are on the boards who understand these things. So no industry is easy. Like I said earlier, if it was easy, you know, that would not be right, I think, in rural communities.
Yeah.
But it's certainly, it is, you know, the ability to become engaged and to educate yourself on what's going on and to ask questions. And if you don't agree with a local decision that happened, you know, you can speak up, you know, come to an understanding of what that was and agree to disagree and move on. But yeah, I think that's also vitally important in any aspect that we work through.
So where can people go to find more information about what you all do?
Yeah, great question. IndianaRuralHealth.org. We're also on Facebook and X and LinkedIn.
Okay.
So you can find us all there. But a lot of our information is on our website. We exist to improve the health of rural Hoosiers throughout the state of Indiana. Our members, we have a very diverse membership. So we have obviously healthcare providers, hospitals, different healthcare businesses and organizations and higher education institutions. And then we also have people, you know, who are just individual members who, you know, family members are healthcare employees and they want to stay connected. You know, I'm biased. I think we're the best rural health association across the country, but, you know, again, I am biased, as most states do have one or something like a rural health association. But yeah, all of our information is there. We do a lot of different programs throughout the state of Indiana in rural communities with a lot of diverse set of partners. If you know of a healthcare organization who is working in your community and, you know, you can connect them with our website, connect them with me, you know, just shoot me a message or something, and would love to always have a conversation.
Okay. Sounds great. Thanks, Dan.
Thank you.
I appreciate it. This is a super important conversation, and I'm sure we could talk for another 30 minutes easily, but this at least scratched the surface, and I hope in the coming budget session we can get some more stuff across the finish line.
Hopefully, yes. Yeah. Thank you for having me.
Thanks. If you enjoyed our conversation today, make sure to subscribe to The Breakdown with INFB and even rate and review us to let us know how we're doing. For more information, visit www.infb.org/podcast.